Hi there, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, my good friend, plastic surgeon, Dr. Joseph Mele. How are you doing?
I'm good. Nice to be here.
Nice to be here. Welcome back to the show. All right, we've got 4 topics to cover, doctor, and let me see if I can get this one right. Blepharoplasty.
Perfect.
Yay! Cosmetic ear surgery, breast implant revision, and abdominal rejuvenation. So lots to talk about. Later, we're going to be taking your phone calls live. So here's the phone number, you guys. Write this down, 415-561-8753, 415-561-8753. And we're also going to put your phone number on later, so get ready to take that down as well. But remember, before we get started, any advice we give you today, we want you to consult your own physician. All right, so thanks again for being here, doctor.
My pleasure.
Let's talk about blepharoplasty.
Okay.
The hardest one to say.
It is hard to say.
Tell our viewers what that is.
So it literally means eyelid changing.
Oh, that's easy.
You know, plasty, like plastic surgery, comes from plasticos, which means to change.
All right.
And bleph has to do with the eyelids.
Well, that's nice and easy. The
Simple.
word is a little difficult, but that's easy.
Yeah, the translation makes it easy.
All right, so who needs the surgery?
It's done mostly for either redundancy of the upper eyelids, where there's too much skin and
Right.
it's hanging down, or it's done for the lower eyelids when there's too much fat or fullness or bags underneath the eye.
Okay, so you can do them upper or lower.
Upper or lower.
Okay, and lower mainly to get the fat out?
Lower, it's usually to get rid of bags, to tighten the lid, get rid of extra skin.
Okay, that's good.
And that's all the cosmetic parts. There's also reconstructive surgeries we do to actually physically tighten the eyelid if it's hanging down too far, or for the upper eyelids to lift it if it's hanging down too far.
Yeah, because some people really have a problem with eyesight if
Yes.
the skin is hanging too low, correct?
Yeah, and if it's because the eyelid's in the wrong position, that requires one type of surgery. If it's because there's just too much skin and it's falling over the lashes, that's a different type of surgery.
All right, so how do you do it?
First thing I do is look at the patient and figure out what's bugging them.
Yeah.
And if it's too much skin, then we remove some of that extra skin. If there's too much fat, we remove some of the fat. Now, I never want to remove all of the fat or all of the skin, because if you take away too much, it causes problems.
Absolutely.
And removing too much fat can kind of skeletonize the eye and actually enhance the age, make you look
Real
older.
hollow there.
Yes.
All right.
And taking away too much skin may make it difficult to close the eye and leave you with dry eyes or uncomfortable eyes. So it definitely, you want to see someone who knows what they're doing.
And you do. So let's go to before and after picture, shall we?
Okay.
There we go. What are we looking at?
So here's someone who had extra skin on the upper eyelid, and you can see how she has multiple folds there.
Yeah.
So instead of one clean fold, there's several little folds where the skin comes down, and after a while it starts to rest on the lashes, and it may feel heavy.
Yeah, yeah,
So what
yeah.
I've done is just clean that up, just take away that extra skin, and it still looks normal.
It looks
like
very
a normal
normal.
eyelid, but just a little bit more open, a little more alert.
Yeah, that is a really good job. What is the recovery time for something like that?
It's a week or two. It just depends
that's
on how
it?
much bruising there is.
Okay, because she only had her uppers done.
Yeah, well, I think I did the lowers also. The lower
Oh,
looks a little bit
really?
smoother there too.
Yeah, you're
but the
right.
recovery is more waiting for bruising to go away. It's not a painful operation. It shouldn't be incapacitating in that way. It's really,
that's good.
it's how much explaining you want to do.
All right, next picture.
So same idea here.
Wow,
So
look at
extra
that.
skin more on the upper outer part of the eyelid.
Oh, definitely.
Inner part, there's a little bit of fat pushing down in there too. And sometimes we do remove a little bit of fat from that upper eyelid.
And it looks, the lower also, if you
And the lower
remove some of
eyelids,
the fat,
yeah, we tighten.
it tightens up. So, you know, a lot of people have the wrinkles under the lower eyelids.
Yes.
And a lot of those are gone in this picture.
In this picture, in the lower eyelids, there's enough extra skin is starting to fold, and there the surgery will help.
Oh.
If it's really fine, crepey fold, where it's not more like quilting on a quilt rather than the quilt folding, then sometimes a chemical peel or lasers will work. We don't have to do the surgery.
I think that's what I need. Let's go to the next picture. Yeah, I got that creping underneath. I hate that.
So here's
All
a
right, what do we
gentleman
got?
with very heavy upper eyelids. And for men, our eyebrows are lower.
Yes.
They're supposed to be. They're kind of at the edge of the bone or sometimes even below the edge of the bone.
Right.
With women, usually want it higher. So with men, I'm trying not to get rid of everything up above because I still want them to look masculine.
Absolutely.
But there's enough here where, again, his eyes open more. There were bags underneath the eyes. Those have been removed. And then the extra skin that's pushing on the eyelashes has been removed.
That looks really good because it's very, very, very subtle. And that's what I want to ask you. What is the difference between male and female? We've got one more picture, however, and then I'm going to ask you that question.
Sure.
And this is a good one, too, because Asian and Caucasian, there's a huge difference, right? How you do that?
There's difference in the anatomy. So the upper eyelids for Caucasian eye have a very well-defined fold.
Right.
In the Asian eyelid, those attachments either are missing or they're attenuated. There's fewer of them.
Oh, okay.
So sometimes we'll see, again, multiple folds, or we'll see a fold that's just not as well developed. And she actually has a pretty good fold even beforehand.
Yeah, that is nice.
And then also the difference on the inside of the eyes is the epicanthal fold, the little fold of skin near the nose. And there are people who want to round their eyes out. They have Asian eyelids and they want more Caucasian eyes, and that can be done cosmetically. And there's lots of folks who like their Asian eyes, they just don't want them blocking their vision.
Exactly.
And then we try and maintain those features.
All right, so what about male, female?
So male, female, again, the biggest difference is men, we expect the brow to be lower. We expect there to be a little bit of extra skin, a little bit of hooding. If we get rid of all of that, it feminizes the eye.
I know we were talking about Kenny Rogers.
I love Kenny Rogers.
I know,
but when you take away all of that extra skin, and especially if you lift the brow, it makes women look more feminine. It makes them look more alert and awake. It makes men look more feminine. And it's a different kind of look.
Yeah, all right. Very, very interesting. Got to go to the right person for sure. If you want more information about Dr. Mele, you can call 925-943-6353. Check him out on the web, either drmele.com or sanfranciscobreast.com. We got plenty more to talk about. We've got so much stuff. 3 more topics to get to, doctor, so we'll be right back on Body Beautiful. Stay tuned.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.